The University of Texas Health Professions Office proudly presents Osteopathic Medicine 101. This is Madison. Madison is thinking about becoming a doctor. She's curious about the DO route, but is getting a lot of conflicting messages online. But don't worry, we're here to help. So what exactly is osteopathic medicine? Osteopathic medicine is a form of modern medicine with the benefit of hands-on diagnosis and treatment through osteopathic manipulative medicine. It places an emphasis on health promotion and disease prevention. Osteopathic medicine was founded by frontier physician Andrew Taylor Still after he became disillusioned with the isolate and treat approach of allopathic medicine at the time. He developed a theory comparing the human body to a machine, identifying the role of a physician to improve mechanical functioning of the body as a means of improving health. In 1892, Dr. Still founded the American School of Osteopathy. Still and his disciples worked to prove the validity of the osteopathic approach through the 1900s. Finally, in 1973, osteopathic medicine was granted full rights to practice in America. Madison has heard a lot of negative things about DO degrees. Let's clarify some myths about the DO field. With osteopathic medicine being so new, there are a lot of myths about the field which should first be clarified. The first myth is that people with DO degrees are not real doctors. This is false. Ever since 1973, those with DO degrees have full rights to practice in America. They are fully accredited physicians who can perform surgery, prescribe treatment, and pursue medical specialties. Second is that DOs have limited rights to practice. Those practicing with DO degrees are held to the same standards as those practicing with an MD degree. DOs have full practicing rights in all the 50 states and beyond. Next is that osteopathic medicine does not use prescription medications or surgical techniques. While osteopathic medicine does incorporate treatment methods outside of drugs, it is still a science-based field of medicine and has changed over time to incorporate varied means of care for their patients. This does include pharmaceuticals and surgery. In addition, DOs are sometimes confused for chiropractors or physical therapists. While all three fields do utilize similar manipulative techniques, they are still different professions with different schools of thought and different educational tracks. Unlike chiropractors or physical therapists, DOs are fully licensed physicians, and manual therapy is only a small part of the DO practice. Many also believe that DOs are doctors who couldn't gain admission to an allopathic medical school. Many students choose a DO degree over an MD degree due to the philosophical differences between the two. Finally, to clarify, osteopaths are not the same as osteopathic physicians. Osteopaths are foreign trained practitioners of osteopathic manipulation and are not physicians. The confusion between the two terms is a result of the reluctance of other countries to fully accept DOs as licensed physicians. US-trained osteopathic physicians are fully licensed to practice medicine in over 65 countries. Osteopathic training focuses on osteopathic manipulative medicine, or OMM. This is care with a focus on the interrelations between the body's structure and function. The curriculum tries to teach an understanding of how the body can be influenced by or influence a human's emotional or spiritual nature. Osteopathic medicine focuses on supporting the body's self-healing mechanisms. People seeking a DO degree apply to osteopathic medical school using the American Association of Colleges of Osteopathic Medicine Application Services, ACOMAS, or TMDSAS for TCOM in Texas. Like allopathic schools, osteopathic medicine has its own standardized test during schooling as well. This three-part standardized test is known as the Comprehensive Osteopathic Medical Licensing Examination of the U.S., also known as the COMPLEX. similar to the USMLE exams taken by allopathic medical school students. In addition, there is an osteopathic-allopathic residency merger happening in 2020, meaning that the residency programs for MD and DO programs will be unified. The complex will also be accepted and compared with equal weight to the USMLE. MDs and DOs are actually very similar in most aspects. The only major difference is the addition of Osteopathic Manipulative Medicine, OMM, to the DO program. When comparing a DO degree to an MD degree, there are some differences that should be highlighted between the two. Osteopathic education started with a different approach to medicine than allopathic. While the education of the two degrees has grown increasingly similar, students of osteopathic medicine learn more about therapeutic techniques. The training process of a DO degree is somewhat different from that of an MD degree. DO schools require an additional 200 hours of training to learn musculoskeletal manipulation. DOs are trained in osteopathic manipulative treatment, OMT, which is hands-on healing method used to treat muscle pain and can help with conditions such as asthma, sinus disorders, and migraines. Finally, the licensing exam between the two degrees differ. Complex versus USMLE. However, though they differ in some aspects, over time, the two fields of medicine have become increasingly similar. Now, there really is not much of a significant difference between osteopathic and allopathic medicine. Both schools base diagnosis and treatment on scientifically proven conclusions, and both have the opportunity to work in specialized and primary care. Students are taught to work in partnership with the patient to achieve wellness by providing health education, injury prevention, and disease prevention in their practice. To summarize, osteopathic medicine is a patient-centered approach focused on treating the body in the context of both its internal and external systems. In addition, both fields follow the same path to get into professional school: a bachelor's degree, completed pre-med coursework, then take the MCAT. Both require a 4-year schooling program followed by a 3 to 7-year residency program. Lastly, both are licensed by the same state licensing boards. Here you can see DO residency match percentages compared to MD residency match percentages. As you can see, many of the DO match percentages are comparable to or higher than those of MD graduates. Although both fields used to be different, they have become more similar over the years. To get more general information about osteopathic medicine and the Osteopathic School of Medicine in Texas, check out our website. If you want to learn more about the osteopathic route, schedule an appointment or come into our walk-ins. Call us at 512-471-3172 or visit us in Painter 5.03. Thanks for watching. Goodbye.